going to go ahead and get started. There may be a few folks who join, but we will respect everyone's time. Thank you all for joining us for this panel conversation and opportunity to share about our work with a program with Nash County Public Schools for over the last 2 years. This is part of the first ever UNC Engagement Week. So if you don't know, there are actually many other events going on, including a number of them through the Health Promotion Disease Prevention Center, where I am based here at UNC. So welcome. We will have some time for some open questions at the end. But if there are other comments or technology needs, please type that into the chat, and we have someone who is sort of monitoring that and can assist with that. So if you do have questions you think of along the way, we'll also gather those as well. So I will introduce myself. I'm Desiree Murray. I am a clinical psychologist and researcher here at the Center for Health Promotion and Disease Prevention. As I mentioned, I am one of the developers of the BCOM Connections program, which is a mindfulness-based program for adolescents that we're going to be sharing a little bit about. And I'm going to be sharing some of the program perspectives, and my partners, Jeannie Kerr and Jennifer Sharp, will be sharing some of the school district perspectives. Jeannie, would you like to introduce yourself, and then I'll have Jennifer go after that?
Sure. Thank you so much. And good morning, everybody. My name is Jeannie Kerr. I'm an LCSW. I have a history in clinical mental health, and then I've been with the school district for 10 years now, and excited with all of our mental health and social emotional learning initiatives that we have going on, especially the past 5 years. And this is something that the state has supported as well. And we now have some state policy. So glad to be a part of this program.
Thank you. Jennifer?
Yes. Good morning, everyone. My name is Jennifer Sharp. This is my 28th year in the Nash County Public Schools and in education. I was an English teacher. I taught ESL, and now I find myself as a principal. One of the things that I've noticed as a principal and over the course of my years in education is the rising need for supports, mental health supports for our young people and our grown people too, but definitely our young folks. And so I was very excited to be able to partner with BCOM, Child Trends and BCOM for this program. And I'm excited about being here today to share more with you about it.
Thank you. So as I mentioned, I'm going to give just a little bit of background on the program, which I think will be kind of helpful context as we talk about our partnership and sort of different perspectives. So sort of the background for our work and that really led to the development of the BCOM program was related to rising concerns about mental health issues in adolescents. And that really predates the pandemic. I think we all really appreciate some of the ways that has been even exacerbated over the last 2 years, but that was really happening before then. And if you really look beyond students who are actually being diagnosed with a mental health condition but are struggling in some other way with a mental health need, or perhaps even showing up at emergency departments, those numbers are really significant. And we also know that those difficulties do impact students at schools in many, many ways, socially, emotionally, as well as academically. And our interest really was in thinking about secondary schools. We're going to be talking today about some work in high schools with ninth graders, but we have also done some of this work in middle school. And we know in terms of other programs that are available that there actually are a lot fewer social emotional programs for adolescents. And so that seemed like an area of need as well as an area of opportunity. And really felt like, given what we know is going on with adolescents developmentally, there's so many changes they're experiencing. Again, we really saw that as an opportunity to target some real age relevant skills and see if we can make a difference that would be long term. So that's where we started with this. And I've sort of already alluded to some of these opportunities. We really see adolescence as an age where we can build some lasting skills. We, in some of our work, noticed not only were there fewer programs available for adolescents, but also that the ones that were there, as we looked at them, had some gaps. And the biggest one, well, really there were two gaps. One of which was that programs really seem to have much less emphasis on supporting students with their emotion regulation than it did with their cognitive problem-solving skills. And we really felt like both of those are important. And the other thing that many programs seem to overlook is just how powerful and important the role of teacher could be. So a lot of programs are really just about a curriculum and skills, which we do have, but our program also really wanted to lean in and thinking about how can we support teachers in supporting students. So that was, again, the backdrop of where we started when we first began developing this program about 5 years ago. And then as we got some new funding, COVID hit. And one of the things, there were some challenges, which we will have an opportunity to discuss, but also, again, I think an opportunity in that I think just nationally, I think there's been increased recognition of the need for and for social emotional supports, and really a call for that. And my experience, certainly with my Nash County partners here today, but also with other school districts that we work with, is that it has only increased sort of, I think, schools' appreciation and awareness for some of those needs and some creative problem solving about how to address those needs. So our program, it is research-based in terms of we've done a small-scale random control trial. We are currently doing sort of an evaluation with a lot of student feedback as well as teacher feedback. So a lot of that is sort of ongoing, but again, the program started from what we know about mindfulness-based programs. We looked very carefully at those because the mindfulness literature, the studies that are just have rapidly increased in the last 20 years really seemed like they were having the most impact in that emotional domain that we were really interested in. So that is sort of what led us to incorporate the mindfulness foundation that we have. But we also looked very carefully at how could we make this a program that is really feasible for teachers. So we spent a lot of time early on collecting input from teachers, school staff, administrators, and students to really think about the needs and the context. Our particular context has been primarily working in rural North Carolina counties. And so there are certainly sort of aspects that, we wanted to understand, as well as understand just like practicalities of teachers in terms of being able to deliver a program like this in a way that was meaningful, and in a way that allowed them to participate in training and at a level that would make a really, our ambition was to make a meaningful difference in terms of teachers understanding of students' social emotional needs, as well as their skills in connecting with and interacting with students. So we have a significant professional development component to our program. And as we will be talking about, we have tried to pay attention to implementation support. And one of the things you'll hear in our discussion is that we are at the point of ending, our current funding is ending. So we're actually in discussion of how can we sustain this? It's easy enough to, well, I don't know if I would say completely easy, but it's much easier having federal grant funding to do programs like this. But when that ends, we all need to think more creatively about sustainability. So we've started those conversations and thinking, and we'll have an opportunity to chat about that later on. This is just a snapshot of where we've been so far over the last 5 years with our program, both middle and high schools, 6 different school districts across the state. And so we have tried to really learn from that. Every time we partner, we feel like we learn things that can be used to make the program better and increase the impact. So that's our goal. That's our kind of continuous quality improvement approach. This is the BCOM Connections program. And it is mindfulness-based, but it really is focused on social emotional learning skills. We focus in particular on some of the connections that students have with friends, family, and at school. And in the process of that work, we address emotion regulation skills and stress management because we believe that those are foundational to good communication and conflict resolution skills. And so the ultimate goal, again, is to build skills that will make a long-term difference in terms of students' mental and emotional well-being. This is just a snapshot of the lesson that the students do. So in addition to 15 to 20 hours of teacher professional development, we have 16, about 45 minutes, perhaps a little bit longer, lessons that we've taught in different contexts. This past year in Nash County, they've been taught as part of AVID in their early colleges. So Principal Sharp can comment on that context a little bit more. We've also worked in other contexts in other schools in terms of advisory period and health class. But this is sort of our sort of sequence of skills that we address. And in our high school module, we include work around identity and values as that informs relationships and boundaries, and then social conflict. So so that's sort of the big picture. And sort of my last commentary before I end the slides here is back to thinking about implementation. And those of you who have done work in schools or really any other community setting will know this well, that implementation really requires a lot more than a good program. We hope we have a good program where we continue to develop it and continue to do studies to really see what the effectiveness is. But in addition to however the program itself is defined and operated, there are a lot of pieces to that implementation, and in terms of on the ground, and in terms of the partnership, in terms of the leadership. So that's part of what we wanted to focus our conversation on today. And also thinking about the context. So one of the things that that I will say, without any hesitation whatsoever, is that Nash County Schools has been a very enabling or supportive context for this program in terms of lots of things. And I will sort of let my partner speak more to that. So this is sort of the formula from the National Implementation Research Network that says if you can put all those pieces together, they have this incredible interactive effect, and that will ultimately support socially significant outcomes, which we are all striving for. So at this point, I'm going to shift us a little bit to some conversation, starting with some of the implementation supports from my perspective, sort of from the program perspective, and then sort of thinking about the implementation from our partner perspective, starting with leadership, because I feel like that is always foundational. So from our perspective, some of the things that we really work to do, first off, had to do with supporting teachers. That really was a critical part of our model. And that's not just giving them more training, but again, thinking about what they need, thinking about how we could spread out supports across time so that they had a time and a place to go to with questions. And as they sort of continue to gain experience and gain skills, we actually, in this particular project, even incorporated video reviews so we could actually provide real feedback, having seen how the program's being delivered in the classroom. So that was some of our supports for teachers. Some of our supports, other supports in the classroom had to do with providing a mental health specialist. So another partnership we had was with a local mental health agency local to Nash County that had a specialist who was present during the lessons, at least this year, in the classroom, and really work closely with the teacher and with supporting student engagement. I would say just the last thing that we have really tried to prioritize is communication, keeping those lines open, not just with email, but other mechanisms and ways that work for different folks, especially in this continued ongoing virtual world. So those are a few of the things that we've tried to do from our perspective. And then I would add, the last thing is we've tried to be really intentional about making sure that this program has the leadership support that it needs. And so here I want to turn to Jeannie first to see what perspectives you would like to share in terms of when we first started having conversations a couple of years ago. What was it that really was on your mind in terms of thinking about a new program, thinking about social emotional learning? What was important from your perspective as a district social emotional learning leader?
Well, there's a number of things that we were considering, and one is that we have a mental health and social emotional learning implementation plan for the district. So looking to see if your program and other programs that we take on are in line with the goals that we have set for ourselves, and also in line with our academic essential standards, because as part of the health essential standards, there are the mental health goals. And so taking all of that into consideration, and felt like the BCom program was a really good match for that, in being in line with what we were trying to do with mental health awareness. And we call it our core instruction. So it's that tier 1, meeting the needs of all students, and felt like that this program really met that need. And also looking at what are our resources and available capacity in this district to be able to implement the program, because that's really important. Did we have the staff resources, the time, if there was any financial obligation, to be able to support that program, and also even looking ahead about sustainability, because it doesn't make sense to take on a program if it's not something that we can sustain. And I think sort of the last piece of that is we have a framework, and this is a education framework, ICE, where you look at instruction, curriculum, and environment. So for one, is this a program? So it was a good curriculum. We had that piece. But instruction, is this something that that pieces of that curriculum can be worked into just the instructional day? Because what we know, obviously, from learning and education is that if we can take whatever skills we're teaching in this area and apply them someplace else, then students are really going to be able to grasp onto them, make them their own, and use them. So that's one thing we always want to consider is, are the skills that we're learning in the curriculum things that the teachers can bring up and intertwine in all their lessons throughout instruction all day, which this is definitely something that they can do. And then the final piece is looking at the environment. So that's when I say ICE, instruction, curriculum, and environment. And with a district, we really are building ourselves to be resilience focused, that positive focus, thinking of those restorative practices framework. And so making sure that whatever we take on is in line with that. And I feel like that the BCom model isn't just the curriculum for the students, but I feel like it also helps really build up that positive environment for our school staff.
Thank you. Thank you. You have been a really valuable support for the program. And I'm wondering if you could just comment on some of the things that you feel like maybe have been helpful that either you personally or the district has done to sort of to make this implementation successful.
I think one of the first things is the buy-in from the leadership and up through the school board, because we have to see that a program has value in that educational setting for our overall educational goals of improving the whole student. So, being able to show the goals of this program and how they definitely feed into that, and spending that time with our district leaders, being able to show that connection, the research behind it, showing, the importance of focusing on these core social emotional learning type skills. And so that was one part of that. I think the other is, as a district, having our own implementation plan internally, and having a plan with that, of following along with the implementation science of how we will get it going, that monitoring, self-improvement of the program, et cetera, is very important. So that's something that I have assisted with. And part of that is collaborating with the agency. So you mentioned the mental health provider, and that's the person who is working with BCom is also part of Yoderon, who was our school-based mental health agency that we work with. So that whole collaboration of all involved stakeholders at a district level, I think, is very important.
Yeah, absolutely. Absolutely critical. As was the support at the building level. So Principal Sharp, sort of similar questions for you. When I think it was Jeannie who first approached you before I ever had any conversation with you. What were your considerations? What did you want or need from a program? And then sort of, if you could secondarily speak to some of the things that you've done to support implementation in your building.
Sure, thank you. So before COVID, this all came about before COVID. Our exigence with the program was that we had students as members of our school improvement team and parents, of course, but our students on our school improvement team were sharing with us that they were just extremely stressed out. We are in early college high school, so they begin college classes in 9th grade, dual with their high school classes. There's a much greater expectation for maturity on them. They carry a heavy course load that is very unlike traditional schools, and they have just a lot more independence and responsibility with their own learning. So our students were saying, we're stressed out. That's where we need help. We need help talking to our parents about how stressed out we are. We need help like in understanding our own selves. And so I contacted Jeannie. And I was like, hey, friend, help me out. Are you aware of anything? And then she brought Be Calm to us. I like the structure of the program. I like that there was the focus groups, the interviews, all the pieces for continuous improvement were built in with the program. And the fact that the teachers would be paired with a mental health specialist, because I knew that would decrease their anxiety immediately. They wouldn't feel like they had to be the mental health expert. They could be the teacher. So very important there. Jeannie spoke about the buy-in at the district level. It was very important for our teachers, our students, and our parents to have buy-in. So because the genesis of this really was out of a student expressed need that parents then recognized and said, okay, we can support this. When we were able to bring it to the students and parents, they were supportive as well. And the teachers especially, because when teachers hear from their students, that puts everything in a different context for them. So we had incredible buy-in among the staff, the students, and the parents to begin with. But that was because we had sought out their input. So I think that's also a critical piece there for an effective implementation and an enabling context. So once we had all that, COVID hit. And then, so you guys were awesome to work with. I'll say that. We had a lot of, what do we do now with this meetings? And we pivoted very quickly. Everything went digital. The teachers were like, okay, we said we were going to do this. So yes, we're going to figure out how to do it digitally. And we ran with it. And then it just became part of the culture of our school. And once it became part of the culture of our school, and it was permeating everything, then it's not a question anymore of if we're going to do it. It's a question of how do we continue doing it? Because this is part of who we are now. So as we've had staff changes, when new folks come on, they're not looking at it like, oh, this is something extra you're asking me to do. They're looking at it as, this is the culture of this school. This is how we do business here, or how we do school here. And I think that's critical as well, because you can't go back every single year and say, okay, well, do we still want to keep doing this? Or we have second thoughts? Like once you've got an implementation in place, if it doesn't take root, then you haven't really implemented anything there. So that has been one of the most effective pieces, I think, is that the teacher support that was given helped create that rootedness in the culture. And then because we did train all the teachers, even the ones who were not delivering the program directly in class. And so then the teachers were able to support it. And that was part of our succession planning, is as students advance in grade level, they've had the curriculum in 9th grade. So now we're in a reinforced support mode all the way through 13th grade with that. It also gave us language to talk about things we needed to talk about in different contexts. So, for example, as the principal, when I'm dealing with discipline issues, I can use the language of self-regulation. What did we learn about that in Be Calm class in activities? And that can trigger into the students thinking about, oh yeah, what did I learn? Oh, what should I have done here? And that reflective piece, even if we've gotten to a point of having a discipline concern, is very powerful as part of a restorative discipline practice. One of the things this year we went through was a comprehensive needs assessment. Our entire district went through this, every school. So we had a team from the Department of Public Instruction come in. They visited every classroom. They were here all day. It's a really involved process. And one of the highlights that was noted in our report, the lead reviewer said that oftentimes when she goes into schools to do these assessments, she hears about programs and things that the school is trying to do, but she doesn't see the real implementation or impact of that. And what she noticed was a teacher, not during a Be Calm lesson, but during a content lesson, using those strategies with a student and the student responding knowledgeably about it, like, not, what are you asking me to do? But like, oh yes, okay. So, and specifically, she referenced the interaction that happened was the student was getting elevated, was getting frustrated because they were struggling with something academically. And the teacher said, I can see that you're getting frustrated right now. Let's take a deep breath. Something so simple, right? So simple, but it was so powerful in that moment, especially for the reviewer, because she saw the immediate impact that had to de-escalate the student, refocus them, bring them back around to the task at hand, and get them into a headspace where they were able to process and make decision, not out of an emotional space, but out of their wise mind, so to speak. So I think I don't want to talk too much, but I've tried to hit all the points there.
Yeah, thank you. One of the things that I can add just from my perspective in terms of like what I have seen on the ground that sort of really tells me how this has been integrated, a couple things. One is just hearing, and again, I think this is really to your credit, Principal Sharp, that you've done things to really make this a culture of the school, like bringing this into your faculty meetings. I mean, that is just such a sort of a tangible way that I think, your whole faculty has learned the language together. And then the other thing that I think, so you all have done this program 2 years now, in varying contexts, and with varying teachers. Maybe 7, 8 teachers, maybe more than that now at this point, who have done some delivery. And this year you had several very new teachers delivering the program, which I often think of can be really hard as a beginning teacher, having sort of a new program. But I will say that those new teachers in particular have been really on board, I think, and felt supported. And I've just been incredibly impressed with how they were able to pick up and deliver a program on top of everything else that one does as a new teacher. So, I mean, I really felt like that could not have happened without the context. That was not our program. That was your context.
Thank you. And 2 of those new teachers are also alumni of the school. And I've heard them say several times, like, I wish we had this when I was a student here. So I think that also increased their buy-ins. They had a dual perspective.
Yes, that's right. So you alluded to kind of COVID and we pivoted, right? Because we planned this before COVID hit, and then we had to figure out how we would try to continue. And again, really, to your district's credit, we're able to have the teachers deliver this during online learning, part of the way. And then the other half last year, I think, was when students were in class on a rotating basis. I mean, it was something. I'll put this question out to both of you because you may both have perspectives on it, but what do you see as the biggest challenges and also the biggest opportunities from COVID for a program like this?
I'll go ahead and start. We were super excited to have it, and it because we knew it was going to be difficult. When we came together in July of 20, thinking about how we didn't even know what the plan was going to be yet at that point, but all of our staff came together for summer leadership to plan for the 2021 school year. And we just felt like we had an ace up our sleeve with this that other schools wouldn't have, because we knew there were going to be significant challenges with students' emotional well-being, because we already were feeling it as adults. So of course, that's going to have an even bigger impact on students, especially if they're at home and they're isolated. And so our team really embraced it and said, this is going to be a key to our success this year, is making sure our students are okay, we're okay, and then we know we'll be able to deliver the curriculum. And we were an outlier among schools as far as our academic performance last year, and we had high growth and some of the highest proficiency scores we've ever had. And we attribute a lot of it to having this program and being able to have really some honest and transparent conversations about how folks were feeling as we were all going through a very traumatic event.
Yeah. Jeannie, what would you like to add to that?
Well, I think there was a couple of things about COVID, just adding on. I think, of course, the difficulty, and we all know this from our virtual world we've been living in, is that it's only a percentage of the communication input output that we're used to having. And Zoom fatigue is a real thing. So oftentimes students, trying to get students, there's just that percentage who would not turn on their videos, and you weren't sure about their engagement level. The other problems was being able to read the students. So for instance, if they're sitting in your class and you're seeing them and all their nonverbal cues and demeanor and personality every day, you can identify problems and concerns and changes and connect them to student services or any other types of resources they need faster. And I think that's been, of course, for everybody, just a problem. And so with this program as well, I think that it can, in some of this discussion, some students who may be struggling with some anxiety may be more forthcoming and willing to get help if they're approached. And so I think that's, again, one of the problems of COVID is the teachers did their best to observe and connect students, but sometimes it wasn't possible. And so I think that was a problem. I think one of the positives is there was that percentage of students who actually said they felt more comfortable and engaged in a higher level virtually than in person, just because of their personalities and who they were. So it's just something for us, a reminder to consider as we have gone back in person, that in person, there's still that percentage of students who actually would be engaging better if we could approach them in a different way. So I think that has been a good lesson for us and something that we have learned. And the other thing, I think that the COVID and having to go online really helped us hone in and streamline how we taught and the effectiveness of programs and what you highlighted, and you really could boil things down to, okay, this is the most important. I'm really going to put my effort into getting this message across or this skill taught, because you knew you had this little window of time before maybe the video did go down, or you couldn't capture their attention in the same way. So I think it really actually honed people's skills in a different way that they can then take back in person. So those are some things, some positives and negatives that I saw with COVID.
Yeah, that's a great perspective, and it sort of continues, right, in different ways. And so we've talked a little bit about sort of the stress of students in the context of COVID, but there's also the stress of teachers, which has been just tremendous. And so I'm interested in the perspective that you all have about, as you think about teachers' stress level, also think about what they need, the supports they need. How does that sort of affect how you think about what programs you bring on board and what you want and need from programs related to supporting teachers?
One of the really awesome things about this program were the clearly defined lesson plans that were already laid out. And so teachers knew that they would have some choice and freedom and autonomy, and they had the weekly meetings with their mental health leader. I'm not using the right word, leader, mental health specialist. And so they kind of worked through, like, what are we going to do this week? Which parts of the lesson are we going to use? Especially with COVID and the remote learning, like there was so much wonderful stuff in those lessons, but they couldn't always use every single bit of it. But those conversations helped the teachers feel not alone. And then we kind of restructured our schedule last year to have whole team meetings every Friday afternoon, where our teachers would work together in their professional learning communities to plan for instruction and also to kind of debrief the week. And then we would debrief as a team, and we brought in some of those same elements from the program into our practice during that time. And because the feedback from the teachers was that was so powerful and important for them, for their well-being and their ability to be the best teacher they could be, we were able to continue that adjusted schedule this school year. So our students actually leave early on Fridays and Friday afternoons, which who wants to stay on a Friday afternoon? Nobody, but our teachers are like, yes, this is great. We get time to work together, even if it's on a Friday afternoon. So we were able to continue that schedule this year, which allowed us to continue some of those practices. And I think that's helped teachers feel more comfortable. There are still times when the teachers will share with me, like, I don't know what to do with this. The kids are having big feelings and I'm not sure I'm equipped, but they know they have resources to go to. They have the specialist, they have me, they have you, Dr. Murray, Ms. Kerr. Usually if they come to me, I'm going to you asking for help. We did have a change in counselor, but our new counselor is already very well versed in restorative practices like restorative circles. She was already doing check-ins. So a lot of when she goes in and she sees this and she's reading, she's like, oh, I'm familiar with that. I know that. So even though she hasn't had the formal training yet, she still can be a resource to them as well.
Thanks. Jeannie, anything to add?
Mm-hmm. So I'm thinking about the stress level of teachers, and I'll add sort of readiness of teachers, because one thing that we have seen as a district and have gotten feedback from teachers as well. So within the district, we have a teacher advisory committee, and there are representatives from all the schools. They meet once a month on different topics. So they are asked for their feedback specifically, and that information is definitely utilized. And so at the very beginning of this year, I talked about our social emotional learning programs and included BCOM in that and some other things that we do. And the feedback, which was interesting from all of the teachers, and I want to say there was about 75 teachers there that day, because we have 30 schools, so representatives from everywhere, and multiple from some, was that they said they liked the SEL programs, but they didn't all feel ready to provide them. And they said, we also see a lot of people in our building who are not in a place to be able to provide those resources. And we actually had already been involved in the state level with SEL implementation and planning. And that's something we've seen across the state, is just that we really need to think about our adult social emotional learning and well-being first, and really help build that capacity. before we ask the adults to do that for our students. And you can do that in line at the same time. And I would say that is one nice thing again about Be Calm, is I feel like there really is that focus on the work, practicing and learning the skills as the adults, and then delivering them with the students. And at the same time, the adults can continue that practice and ongoing growth of themselves. And I think that that is so important. I think just handing a program to adults and saying, hey, implement this, without putting that piece to take care of the adults and to build their capacity, is just not as effective. So I think that that's one thing with our teacher stress that we really need to keep in mind. And I would say the other piece that we have seen, and again, in the district and also across the state, is this, I'll say, decreasing respect or support of education or teachers, and the teachers feel that. And a lot of misunderstanding about all the tasks that it takes to be a classroom teacher, and not just mentioning all the other roles in education, and just things being said about their short days and the lot of free time they have, which of course everybody laughs. And so I think the other thing that I think is important about programs is being very understanding of the tasks and responsibilities of teachers. And as Jennifer said, coming in with something that is already done, so that it is not, the teachers can take it and use it without putting so much of their own time, but at the same time still are able to tweak it and make it their own. Because I think that's important, because they all have their own flair and their own desire to share things in certain ways. So I think that's important. And I would say the final thing in helping with the stressors, and I've seen you all do this, is being really transparent about some areas that may be problems that they may come across, and also being available to help solve those problems, and ahead of time being transparent about, hey, these are some solutions we have thought of, but what do you all think? And really pulling them in as equal partners in the implementation, just to help reduce all of that stress that they feel.
Thanks. So my last questions are about sustainability. As I mentioned earlier, those conversations are just starting. So there are absolutely things that we would like to do, because we're committed to sort of longer term partnerships that would really build capacity within schools and districts to be able to sustain. So some of the things that we have as part of our thinking are things like identifying who within the schools may be able to serve in a role like a peer coach, somebody who really is going to have some expertise and be willing to work with and support other teachers as they're onboarded and as they're sort of turnover from year to year. How can we make sure that as a new program that we have sort of the systems and processes in place where our partners can rely upon us, so that every year, this training will be available for new staff? How can we offer some of our skills and expertise as academic partners to be able to continue to support continuous quality improvement? I'll give one example that's been super helpful this year, is that once a month, we ask the students to do a 5-minute survey to tell us how interested they are and how much they're actually using and practicing. And we actually shared that back with the teachers recently, and saw, well, here's some good parts of the feedback, and also some areas where we have some ideas about where we can continue to enhance things. So those are some of our ideas, and again, sort of in full transparency, those conversations are still early on, but I thought it may be helpful for this meeting to share from your perspective, starting with you, Jeannie, what do you need and want from a program in terms of supporting sustainability.
Right. I would say that it's important to have that support to develop an implementation plan with built-in oversight and monitoring, because I think that's an important piece. And with that, having that person who is in charge or identified who can continue working with district leaders to maintain that buy-in, because of course there's turnover at all levels. So that buy-in and that interest and that needs to continue. The other part of that is, like you mentioned, I think it's really important for districts or schools to have their own coaches or champions, people who can train others and support others and keep that program going. That's a really important piece of it. And then also is with what I've seen, and I'm sort of thinking in terms of numerous programs that we use, is that it needs to be something that can be sustainable, dependent, if finances go up and down, because there are some programs that are completely subscription based. And that is a problem, because it may be that you don't have the money for the entire subscription one year, but some where there's that combination where you do have some things that you can continue, even if there is some other extra things that you can add on and, other cost. But it's something that if your costs go up and down, which unfortunately they do in education, that you can continue the program at various levels, as in bringing on more things, or else, okay, let's maintain with the support of the agency. I think that really makes a huge difference, just because I would love to say that we are always in the money, but unfortunately in education, we are not.
That's helpful. Principal Sharp, what would you like to add?
I second everything Ms. Kerr said. I think for our particular context, I was just thinking about this as I was sitting here and she was talking. I'm wondering how we could leverage our partnership with the community college to maybe help support continued implementation. I know we've already begun some idea generation around, especially having the mental health specialist continue. I mean, I know that's going to be money intensive, but it's critical. I think it's really critical to helping the teachers feel confident and comfortable in delivering the program, and to have that collaboration and feedback and all of those pieces is so important. And it's important to pay people for the work they do.
Thank you. Thank you. Really, really incredibly helpful perspective, some of which I've heard you say, and then some of which not in exactly the same way. So certainly valuable for me. We have just a few minutes left. If folks have questions, you can either type them into the chat, or you're also free to take yourself off of mute and just chime in. The group is not too big to do that. Well, not seeing or hearing any questions. I guess we will wrap up. I want to say again just how much I appreciate your time, Jeannie and Jennifer. It has been a really really positive partnership, and I look forward to continuing that partnership in other ways after the grant period.
Thank you very much.
Thank you everyone for joining.
Thank you for letting us share about our experience.
And thank you for sharing your program with us as a district. It has been wonderful.
Absolutely welcome.